Good afternoon, and thank you for joining us. Today is Tuesday, November 9th, and on today's briefing, we'll hear from Mayor Tom Barrett, Dr. Ben Weston, Associate Professor with the Medical College of Wisconsin and Chief Health Policy Advisor with Milwaukee County, Commissioner Kirsten Johnson, Commissioner of Health with the Milwaukee Health Department, and Dr. Smriti Kari, President of Primary Care with Children's Wisconsin. Thank you all for being here, and Mayor Barrett, I'll hand things over to you to get us started.
Well, thank you very much, Catherine, and it's great to join you this afternoon. I will begin my remarks with an update on our COVID-19 gating metrics. Unfortunately, we have increased to the extreme transmission category for COVID-19 cases per 100,000. We're up to 152.3 per 100,000. To put that in perspective, last week we were at 122.8 per 100,000. So it's a pretty significant jump in just this last week. Our percent positivity rate remains in the moderate transmission category. That's up slightly, up to 6.4%. The numbers that I would like to see change dramatically, but have not been changing as quickly as I would like them to see, are our vaccination rates. 58.5% of city of Milwaukee adults, that's individuals 16 or over, are fully vaccinated, and 63.5% of adults have received at least one dose. After seeing our numbers continue to fall over the past few weeks, I am again not happy that we are seeing them go in the other direction. We do not want to reverse the positive trend that we have been experiencing over the last month. And so I think it's again another reminder that we are not out of the woods yet, and we have to do everything we can to act responsibly for ourselves, for our families, and for other people in the community. We also know, despite what you might hear sometimes, vaccination is the best way we can protect ourselves, our families, and our community from COVID-19 virus. So we're going to continue to put as much effort as possible on vaccinations. And as announced last week, it was very, very important and big news that children aged 5 to 11 are now eligible for the COVID-19 vaccine. And we've already gone to work in a very proactive, assertive fashion. The health department has partnered with Milwaukee Public Schools, with private schools like the Seton Catholic Schools, and Children Wisconsin to provide 22 community vaccine clinics at schools across Milwaukee this month. And so I'm very, very pleased that already we're seeing a very solid, positive response from parents who want their kids between the ages of 5 and 11 to be vaccinated. The school-based clinics began yesterday, and already the health department has administered 64 vaccines total at both Hartford University School and today at Townsend Public School. This is another stride forward in our work to rid our community of the COVID-19 virus. I strongly encourage every parent of an eligible child to seek good information, talk to medical professionals, and make good decisions about vaccinations. And on Saturday, November 13th, the Milwaukee Health Department will have an exciting vaccination opportunity with the Milwaukee Bucks that the commissioner will share more details on shortly. The full schedule of vaccination clinics is available at milwaukee.gov/COVIDVax. So take a look at that. Again, this is something that we are going to continue to partner with the Milwaukee Public Schools and the private schools through the end of this month and into next month. So please take advantage of this for your children as well. A reminder of drive-through vaccination clinics. If you are seeking a booster dose, a second dose, a flu shot, or your initial dose of COVID-19 vaccine, the health department continues to offer drive-through testing and vaccinations at our 3 community clinics. These locations are the Northwest Health Center at 7630 West Mill Road and the Southside Health Clinic at 1639 South 23rd Street, Monday and Fridays, 9 a.m. to 3 p.m., Tuesdays and Thursdays, noon to 6, and Saturdays, 9 to 1 p.m. Our new Menominee Valley site, which is just off the interstate at 2401 West St. Paul Avenue. You could not have easier access to this if you tried. That is going to be open Monday, Wednesdays, and Fridays, noon to 6, and Tuesdays and Thursdays, 9 a.m. to 3 p.m. So a lot going on. We're continuing the fight, but there's still more work to be done. And helping us lead that charge is Dr. Weston. So I will turn it over to Dr. Weston. Doctor?
All right, thank you, Mr. Mayor. Good afternoon. First, to our numbers, we're currently seeing in Milwaukee County an average of 166 new cases per day and about 2 deaths per day. And after a consistent downtrend, we're seeing an increase in cases, in positivity, and in hospitalizations. Now, with only 50% of our population vaccinated, this is an important reminder that there is a lot more fuel to burn when it comes to COVID infections. We cannot predict whether the coming months will be a reprieve or a struggle, but we do know that the vaccine is the key to decreasing the burden of disease and allowing us as a community to move forward. Now, last Thursday was a big day for many parents, and it was a big day for me. That was the day when official CDC guidance on vaccinating 5 to 11-year-olds came out, and the DHS gave the green light for Wisconsin vaccinators to begin protecting this age group. It was an exciting day for me because I got my kiddo vaccinated. And not only did I have a chance to talk with my own child about the vaccine, but I was able to talk to a number of kids in different communities in the county. Vaccine discussions come up in my household with some regularity, as you might imagine, but many kids hear a lot more about COVID and about the vaccine than we may think. And one theme that I heard from many different kids, my own included, is a mix of feelings, both excitement for the vaccination, but also fear of the shot. Now, in fact, on our way to the clinic, my child asked me if the vaccine was safe. Now, again, they hear more than we may think. So I reassured that thousands of kids had already gotten the vaccine to make sure that it was safe for everyone else. And because of those kids, we know that for those who have or will receive the vaccine, that it's safe and that it's effective. We're starting to see data trickle in on these kids, some of whom were vaccinated as early as last Wednesday. My kiddo was fine the next day, no side effects. Same the following day and the one after that. And for each of those days, for my child and the others who've received the vaccine, inside their body was building up immunity. It was learning to recognize the virus so that when someday, inevitably, they're exposed to it, they're less likely to get sick, less likely to spread it to others, and less likely to suffer the all too common long-term effects of the infection. So we're grateful to those thousands of kids who tested the vaccine for us to make sure that it's safe and make sure that it's effective. But not everyone is quite as early an adopter. It will take time to get kids vaccinated. The Kaiser Family Foundation tells us that about 1/3 of parents plan to get their 5 to 11-year-old vaccinated right away. Another third want to wait a bit, and another third doesn't plan to. Now, much as they have with adults, these numbers will shift as more people see the safety and the effectiveness of the vaccine in kids. But for the time being, we're a long way off from all kids being vaccinated. And that means we need to continue to remember the basics: masking indoors, physical distancing, ventilation. You can find vaccine locations on healthymke.com. And there's also 2 other exciting programs coming to that website. First, there's a toolkit available to help guide parents looking to get their kids vaccinated against COVID. It's normal to have questions about the vaccine and to not be quite sure how to discuss the vaccine with your kids. So this free online toolkit provides information on how to prepare for the vaccine, including key discussion points and conversations to consider having with your kids. There's also information on how to prepare for and schedule your appointment. And additionally, there's downloadable documents and graphics that can be put up in schools and partner organizations to use and share as resources to parents and families, providing them with information about the COVID vaccine. We all can make a difference in sharing facts and debunking misconceptions about the vaccine. And finally, I'd like to invite everyone to participate in the free, family-friendly Fact or Cap virtual game show next Tuesday, November 16th from 7 to 8 p.m. This is an online game show series that'll test your family's knowledge of health and COVID through fun, trivia-style questions. The game can be played on a computer or a phone. Participants will have the opportunity to answer true or false, or fact or cap, as the kids, I'm told, are saying, as well as fill in the blank questions. And not only is this an entertaining activity for the whole family, but you also have the opportunity to win cash prizes and enjoy live entertainment from a range of DJs during the game. So the winner will be announced during the game. You can go to healthymke.com/fact-or-cap for more information and to register. Thank you very much. Stay safe, and I'll hand it to Commissioner Johnson.
Thank you, Dr. Weston. I too was quite excited last Thursday when our children were finally eligible to be vaccinated. And similar to Dr. Weston, my kids, my 5- and 6-year-old, were well aware of the importance of being vaccinated, and they were excited to contribute and to help. All of that said, there was still crying and gnashing of teeth, as you'd expect with a 5- and 6-year-old, but after it was done, one of them exclaimed, "It didn't hurt at all." So I really want to encourage parents and families to get your kids vaccinated. It is the way that we're going to drive our numbers down and to protect our children and the people who are the adults who are in their lives and around them. As the mayor briefly noted, we're excited to announce an upcoming vaccination clinic in partnership with the Milwaukee Bucks. This Saturday, November 13th, we're bringing vaccine to the Visor Forum atrium from 10 a.m. until 2 p.m. While we are predominantly focusing on vaccine for the newly eligible 5 to 11-year-olds, we'll also have first, second, and booster doses of Pfizer, Moderna, and J&J, as well as flu shots available for anyone who's interested. In addition to this opportunity to get vaccinated in the home of the world champion Milwaukee Bucks, everyone vaccinated at this clinic will be able to take a photo with the Larry O'Brien Championship trophy. No appointment is necessary. Free parking will be provided in the Highland Street parking garage, and children under the age of 18 will need a parent or guardian permission to receive the vaccine. We'll host another clinic at the Pfizer Forum on Saturday, December 4th from 10 a.m. until 2 p.m. to administer the second doses. At this clinic, anyone vaccinated will be entered to win one of 2 family 4-packs of tickets for that night's 7:30 p.m. Bucks game against the Miami Heat. We hope the opportunity to take a shot in the home of the 2021 world champion Milwaukee Bucks will encourage Milwaukee children and families to get vaccinated. Additionally, $25 gift cards are still available for City of Milwaukee residents to receive their second dose of vaccine at the Northwest Health Center, Southside Health Center, or the Menominee Valley drive-through site. It is imperative for everyone to receive both doses of the COVID vaccine to elicit the full immune response. For individuals who have not prioritized completing their vaccination series, now is the time to do it. The gift cards will continue to be handed out on site and available only while supplies last. Finally, I want to share a reminder that open enrollment is underway for healthcare.gov. Our pandemic experience has shown us that staying healthy helps us stay on the job and in school, and health insurance is a tool that helps us get there. The deadline for open enrollment is January 15th, 2022 for coverage beginning February 1st. But for those of you who need coverage beginning January 1st, you must complete enrollment by December 15th, 2021. For anyone who needs assistance in enrolling in these state and federal healthcare programs, the Community Healthcare Access Program, CHAP, and UWM Norris Health Center are available to connect City of Milwaukee residents to the right insurance plan. CHAP has one-on-one virtual appointments available this Thursday, November 11th, and again on December 9th. You can call the City of Milwaukee Health Department Community Healthcare Access Program at 414-286-8620 or schedule your appointment online. You can visit milwaukee.gov/health for more information and a direct link to schedule an appointment. I'll now pass it over to Dr. Kari from Children's Wisconsin.
Thank you, Commissioner Johnson. As Dr. Weston and Commissioner Johnson both shared, it's always fun to hear the parent stories of taking their own kids in for the vaccine. So the addition of the 5 to 11-year-old vaccination possibilities has just been an absolutely phenomenal thing that all of us have been waiting for. We're excited to be part of delivering this vaccine as quickly as possible as we can to the kids. And we're doing that within our primary care offices. We have lots of Saturday clinics scheduled, as well as in partnership with the Milwaukee Health Department and the Milwaukee Public Schools and the Seton Catholic Schools. So excited to create as much access as we can for the vaccine. I think the most important thing that parents need to know that all of us pediatricians truly believe that this vaccine is safe and effective. We've been able to see a lot of data and have certainly been reassured with the impact that this vaccine will have, and we'll continue to watch it closely and carefully as we continue to vaccinate kids. Kids are We've seen a lot of very excited children come through our clinic in the last few days. They've been waiting, especially the ones who have older siblings, have felt a bit left out of the vaccination game. So they're excited to be part of this. That's important. I think children love to help others. They love to help their friends, their family, their caregivers. And so really leaning on that as parents to sort of encourage them to be able to get the vaccine because it keeps them safe and it keeps our community safe. That's a lovely way to get them engaged. Shots do hurt a little bit, but, trying to figure out how we can give kids choices, if it's even just in your left arm or your right arm as the choice, or the location where they go, it feels like they have a little bit more control over the process. So that's important. That's one of the things that tends to reassure kids. And then, of course, trying to figure out what treat they can get after the vaccine is always a fun activity and a conversation to have with the kids. If you know that there are other children that are their friends or cousins or siblings who can get the vaccine, going with them is also one of the nice ways to do that, or at least calling that out is a wonderful way to do that. And then, the best part about 5 to 11-year-old vaccines being approved right now is the fact that you could get the 2 doses and be ready for the holiday season and be able to, really enjoy the holiday season with your friends and family. And so we're excited about that. Just to sort of repeat what Dr. Veston said, it is important to continue other mitigation methods, the masking, the social distancing, washing your hands, all of those things are really important until we get the numbers for COVID-19 lower in the community. So that's something that we definitely are still recommending. But every day that we have more people vaccinated, our community is safer. And then lastly, any caregivers and parents for kids, one of the best ways to encourage your kids to be comfortable with the vaccination is making sure that you're getting the vaccination yourself. And always a good reminder that this is also the time for the flu vaccine. So let's keep our community safe this winter and let's get everybody vaccinated that can be. So with that, I'll return back to Catherine. Thank you.
Thank you, Dr. Curry. And now we'll move into the media Q&A portion of our briefing. Our first few questions come from Uba Ali with Team J4. There are several questions, so I'll ask them one at a time here. Our first one is for Commissioner Johnson. She wants to know, how has the Aaron Rodgers information impacted vaccinations?
So we really have not seen an impact on our demand for vaccinations since Aaron Rodgers came out publicly. I think that's great news for us. That said, it's hard to know. We're doing a big push for 5 to 11-year-olds, and it's certainly it's concerning.
Let me just jump in there if I might. I think Aaron Rodgers is a great football player, and I would love to have him be the quarterback for the Green Bay Packers for as long as he's healthy and is playing as well as he is. Commissioner Johnson, Dr. Weston, Dr. Kare are the quarterbacks fighting this pandemic. And they're the ones that I'm listening to because they are the ones that have committed their lives to public health and to the health of the people in this community. And I think that we should allow the public health experts and the medical experts to quarterback this fight. It's more important than any football game.
Thank you, Mayor. Thank you, Commissioner. We have a few more questions. The next one is for Dr. Weston here. Are more people wanting to try ivermectin? What are your thoughts on people wanting to use ivermectin instead of an FDA-approved vaccine? And should people try it? That again, these questions are still from Uba Ali.
So, unfortunately, when you look at the full body of research on ivermectin and COVID, the data is just not there to support a benefit to its use. There's a great summary, an excellent summary report. It's from the Cochrane Review. It's one of the most respected medical institutions in the world. It's a free review. It's available online, and it objectively and without bias goes through all of the studies, all of the data available on ivermectin and COVID. This is a thorough review, and unfortunately, it just doesn't seem to add up that this drug makes a difference with COVID. And in addition to that lack of demonstrated benefit, there's also many known and potentially dangerous side effects to this medication, like any other medication. So in the end, no, I would not recommend the use of ivermectin.
Our next question is for Commissioner Johnson. UBA wants to know, has Aaron Rodgers' message hurt public health messages about getting vaccinated?
So, the message that we've been hearing, or that we've heard from Aaron Rodgers, is not unique. I mean, this is the same messaging that we've heard from other groups and individuals. So it's not unique to him. He heard it someplace else first. It does not change our message, which has been all along to follow the science, to look at research that's been done, to look at the process the FDA and the CDC went through in approving the COVID vaccine, and that they're safe and they are effective. And that message has not changed.
Our next question is for Dr. Weston. Does this misinformation from Rodgers hurt the state of Wisconsin, Milwaukee County in particular? And what is being done to fight this misinformation?
Well, I think misinformation from any source is a challenge, and has been a challenge throughout the pandemic. But the more we talk about misinformation, the more it's perpetuated. But we can talk about facts. We can talk about what we've learned after well over a year of experience with over 200 million vaccines administered in the United States and billions worldwide. And that is that no matter who you are, the vaccine makes you less likely to get infected. It makes you less likely to need to quarantine, and it makes you less likely to suffer long-term effects from COVID infection. And equally important, the vaccine can reduce the risk of spreading the virus to others. So getting vaccinated protects you, it protects your family, and it protects your community.
Dr. Weston, how does this impact getting more people vaccinated, this misinformation? And do you think it's impacting children 5 to 11-year-olds getting vaccinated?
Well, like I said, I think our kids hear more than we may think. They know more about the vaccines and about this pandemic than we might imagine. And while misinformation can certainly derail their confidence, I think sharing facts can get them back on track. So share facts, share that thousands of kids have been vaccinated already in the trials, share that the vaccine is safe, share that the vaccine prevents them from getting sick, prevents them from spreading disease to others, and keeps their family and their community safe.
Yep, Dr. Kari, I think you're on mute.
Sorry about that. Just a quick point to that. I appreciate what Dr. Weston just shared. Hesitation around vaccines is something that pediatricians and family practitioners work with families with for years. And so we stand ready to answer any questions that people have that can help reassure them. So yes, misinformation is something that we worry about, but we have the ability to be able to share information from trusted medical resources, and we stand ready to do that.
Thank you, Dr. Curry. Uba's last question, perhaps, Mayor, you might be able to chime in here. She's just saying that Rodgers is a public figure putting out misinformation, and how can this be damaging to the community?
Well, again, the thing that I want to emphasize once again is people look at role models for guidance. And when I'm looking for role models in football, I look to Aaron Rodgers, the way he plays on the field. When I look for role models in health, I look to Dr. Weston, Dr. Johnson, Dr. Kari, because not only are they role models, they're experts. And I think that's what we as a society have to do. We have to follow the science. And I am proud that through the year and a half that we've been going through this pandemic, at every juncture, we have looked to the science, not to the media, not to the politicians, not to the athletes, to the science. And as we try to fight our way through this pandemic, we have to stay the course and rely on what we have accepted in virtually every other disease in society. I find it ironic that people are saying, well, I'll take any prescription that the doctor provides me, except for this one. I don't know how this has become so politicized. So again, I think we just have to stay the course here and follow the science and the medical experts.
Thank you, Mayor. We have a follow-up question from Derek Rose with WISN 12. He says, Pfizer CEO says people who spread misinformation on COVID vaccines are criminals. Is that an accurate description of people who spread misinformation on vaccines? If not, how do you describe those individuals?
Well, I think there's a difference between misinformation and disinformation. So disinformation is the purposeful spreading of that misinformation to try to do harm. Misinformation, like the commissioner said, this isn't made up by Aaron Rodgers. These are things he's heard from other people and that have been perpetuated. And so I think when we see misinformation, we want to address it with facts. We want to address it with the evidence about the vaccine, about the safety and the efficacy of the vaccine.
All right, our next two questions are for the city. I believe there's similar questions, one from Derek Williams with Fox 6 and one from Allison. They're just looking for a clarification on the number citywide of how many kids in the new age group, 5 to 11-year-olds, have been vaccinated at the Milwaukee Health Department locations.
I apologize. I don't have the most up-to-date information. I do know that by Saturday, we had vaccinated roughly around 400 at our 3 sites. I don't know how many we've done at the school sites yet since yesterday.
The information I had yesterday at Hartford, and I don't know if it included Townsend today, I think it may have, was 64 at these schools. So again, the department-wide number is going to be much larger than those school-specific numbers.
Excellent. Thank you both. And then from Allison Durr with the Milwaukee Journal Sentinel for health officials, she says, what is your sense for what's causing the rise in cases, positivity, and hospitalizations?
Well, I think throughout the pandemic, we've seen that it's hard to pinpoint a cause of what goes up and what goes down. We only have about 57% of our population vaccinated right now. That's just not enough to control the spread of disease. And so we will see as mitigation efforts start and stop, as things like school start and stop, holidays come and go, cold weather comes and goes with people gathering indoors. Each of these things affects the virus and affects the trends. But in the end, no one can give an answer of where we'll be in a month, in 2 months, even in a week. So we'll continue to do our part with mitigation efforts, and the community can continue to do its part as well with mitigation, and most importantly, with getting vaccinated.
Thank you, Dr. Weston. I believe those are all of the questions I am seeing in our chat for today. So thank you all for joining us, and we will see you again next week with the new briefing link. Take care.
Thanks, everybody.
Thank you.
Thank you.